Hello friends, hi, welcome to my channel The Voice of Nurse. We are discussing regarding NHM 2022 July Staff Nurse Solved Questions paper with explanation. This is part 2 friends. In previous video I already explained part 1 NHM 2022 questions and answers with explanation. Next move on to topic continuation 60 questions to 100. The part 1 first question to 40 questions is there in previous video. Please friends check it once. Not only this NHM 2022 part 1, in previous videos I already explained regarding subject wise questions in regarding nutrition and NHM 2022 another paper of NHM and also NHM 2023 recent January paper also I explained detailing. Just check it once. Next move on to topic. We'll discuss questions number 41 to 100. Continuation topic. The 41 question is the process of fusion of a single mature ovum in the tubal ampulla to from the zygote is called as. We'll see the options here. Option A cleavage, option B implantation, option C fertilization and option D apposition. Here option C is the correct answer. What is meaning of fertilization? Fertilization, the union male and female germ cells to the form a zygote. The process of fusion of single spermatozoa with a single mature ovum in the tubal ampulla to the form a zygote is called as fertilization. So here option C is the correct answer, fertilization. Move on to question number 42. The major medications used to treat hyperthyroidism includes all the except options. Option A iodide, option B methimazole, option C methadone, option D profylthiouracil. Here option C is the correct answer, methadone. Methadone in the blood serum and not affect thyroid function because methadone has no effect on the concentration of these hormones. Okay friends, what is meaning of iodine? The option A actually here except the methadone. The condition is except regarding hypothyroidism is methadone. But what is the action? Medication of iodide. Iodide is a radioactive iodide treatment for the hyperthyroidism and thyroid cancer. Next, option B, methimazole. What is the use of medication methimazole? The methimazole is a first choice for the treating hyperthyroidism. Next, option 4, profylthiouracil. Profylthiouracil is used before thyroid surgery and radioactive added treatment. So these three medicine can be used for hypothyroidism, but option 3 methadone is not using for hyperthyroidism. The except medication here hyperthyroidism is methadone. Option C is the correct answer. Next move on to question number 43. Dilated veins around the umbilicus in a patient with cirrhosis of liver is called as. You will see the options here. Option A caput succedaneum, option B linea nigra, option C caput medusa and option D stria. Here option C is the correct answer, caput medusa. The dilated veins around the umbilicus in a patient with cirrhosis of liver is called as caput medusa. Actually, we have to know the definition of caput medusa. Caput medusa is the appearance of distended and engorged superficial epigastric veins around the umbilicus across the abdomen is called as caput medusa. Caput medusa is one of the cardinal features of portal hypertension. Here, umbilicus, around the umbilicus, dilated veins in the case of cirrhosis of liver is called as caput medusa. Option C is the correct answer. On to question number 44. An example for non-opioid analgesics is, actually I have to mention noun here, mistakenly typed as ono, but here non-opioid analgesics. So you will see the options here. Option A acetaminophen, option B methadone and option C diazepam and option D ethambutol. Here option A is the correct answer, acetaminophen. Acetaminophen is used to treat mild to moderate pain like headaches, menstrual periods, and toothache, backache, and cold flu, and also arthritis. Okay friends, the non-opioid analgesics is option A, acetaminophen. Move on to question number 45. Bands of fibrous tissue that connects bone at joints and provides stability during the movement is option A, brusae, option B, tendon sheaths, option C, ligament and option D, cartilage. Here option C, ligament is the correct answer. Ligament are elastic bands of tissue that connects bones to each other and provide stability and strength to the joints. Ligament often connect two bones together, particularly in the joints. So, option C is the correct answer, ligament. Number 46. Hepatitis A is transmitted through all of the following routes except. You will see the options. Option A, fecal oral route. Option B, parenteral route. Option C, droplet nuclei, and option D, sexual transmission. Here, hepatitis A is transmitted through indigestion of contaminated food and water or through the contact with infected person. So, here droplet nuclei is the correct answer. Option C, hepatitis A is transmitted through the accept droplet nuclei. So, fecal-oral route food. Parenteral route also is the one of the transmitted for hepatitis A. Sexual transmission. The means the infected person can contact with other person, means that is a communicable. So hepatitis A is transmitted to the one person to another person. So here option C is the correct answer. Droplet nuclei is the except condition transmission of hepatitis A. Move on to question number 47. The average number of years that will be lived by those born alive into a population if the current age specific mortality rates persist is called as. You will see the options. Option A, crude death rate. Option B, expectation of life. Option C, year of potential life lost. And option D, proportional mortality rate. Here option B is the correct answer, expectation of life. What is the word expectation of life meaning? Expectation of life in word we can say the average lifespan of the an individual. Okay friends, in word expectation of life can say the average lifespan of a individual. So the term life expectation refers to the number of years a person can expect to live. So here option B is the correct answer. Expectation of life is called as average number of years that will be lived by those born alive in the population if the current age specific mortality rate is called as expectation of life. Next, move on to question number 48. Leprosy is also known as option A, fever, option B, Addison's disease, option C, Hansen's disease, option D, whooping cough. Leprosy is the infection caused by a slow growing bacteria is called as Mycobacterium leprae. It can affect the nose, skin, eyes and lining of the nose. Microorganism was discovered by the Dr. Gerhard Hermann Hansen in 1874. That's why the illness was called as Hansen disease. So here option C is the correct answer. Leprosy is also called as Hansen's disease. Next, move on to question number 49. Causative organism of smallpox is. We'll see the options here. Option A, varicella zoster virus. Option B, variola virus. Option C, myxovi virus. Option D, cytomegalovirus. Here, positive organism of smallpox is option B, variola virus. Variola virus, the smallpox is a serious infectious disease caused by the variola virus. It spread from the one person to another person. This is the one of the communicable disease. Okay friends, here we have to know what is the viruses caused the organisms to the diseases. We will see the first varicella zoster virus. It is a causative organism for chicken pox. Next, myxovirus. Myxovirus myxovirus is the causative organism for mumps, measles in humans. Next, cytomegalovirus. Cytomegalovirus is hepatitis related to liver problems. So, causative organism of smallpox is variola virus. This is the correct answer. Next, move on to question number 50. What is the antidote to treat magnesium toxicity? Here we will see the options here: potassium chloride, calcium gluconate, potassium sulfate and naloxone. Here the calcium gluconate is the antidote to treat magnesium toxicity. We will discuss regarding options. Option A, potassium chloride, used for the treat low potassium levels, hypokalemia levels in the body. So this is the treatment for hypokalemia. Next, option C, protamine sulfate is antidote for heparin. Next, option D, naloxone. Naloxone is a rare medicine and also life-saving medication that can reserve an overdose from the opiates, for example heroin, fentanyl. Okay friends, the calcium gluconate, option B is correct answer here. The calcium gluconate is the antidote for the magnesium toxicity. Is the calcium gluconate 1 gram IV over the 3 minutes. Repeat doses may be necessary as by the doctor's advice. Here option B is the correct answer, calcium gluconate antidote for the magnesium toxicity. Next, move on to question number 51. Which of the following drugs will be administered to treat anaphylaxis? We'll see the options here. Option A, atropine. Option B, sodium bicarbonate. And option C, digoxin. And option D, epinephrine. Here option D is the correct answer, epinephrine. Epinephrine is the first and most important treatment for the anaphylaxis, and it should be administered as soon as anaphylaxis is recognized to prevent the life-threatening symptoms. Here option D is the correct answer, epinephrine. What is meaning of anaphylaxis? Anaphylaxis is a severe, potentially life-threatening allergic reaction. It can occur with the second or minutes after administering the medications. Okay friends, anaphylaxis is epinephrine. Option D is the correct answer. Question number 52. FAST is a rapid bedside test in emergency room. FAST stands for what? Options. Option A, focused abdominal sonography for trauma. Option B, fast assessment with sonography for trauma. And option C, focused assessment with sonography for trauma. And option D, fast abdominal sonography for trauma. Here option A is the correct answer, focused abdominal sonography for trauma. The focused assessment with sonography for trauma is an examination performed by surgeon physician as the screening test for the blood around the heart and abdominal cavity. Means pericardial effusion, for example. The FAST means option A, focused abdominal sonography for trauma, is a ultrasound protocol developed for the assess the hemoperitoneal and hemopericardium also. So here option A is the correct answer. Next, move on to question number 53. Death of women during pregnancy or within 42 days of termination of pregnancy, irrespective of duration and site of pregnancy, is. We will see the options here. Option A, maternal mortality rate. Option B, neonatal mortality rate. Option C, maternal neonatal rate. And option D, maternal reproductive rate. Here, death of woman during the pregnancy within 42 days of pregnancy, termination of pregnancy, is called as maternal mortality rate, MMR. The annual number of female deaths from any cause related to pregnancy or during childbirth within 42 days of termination of pregnancy is called as maternal mortality rate, MMR. The ratio is number of maternal deaths divided by number of live births into 1 lakh. Next, move on to question number 54. Occupational hazard associated with inhalation of cotton fibers is called as. We will see the options here. Option A, bisonosis. Option B. Bagosis. Option C. Silicosis. And option D. Asbestosis. Here, the inhalation of cotton fiber is called as option A. Bisiniosis. Characterized by Bisonosis is characterized by inhaling the cotton fibers. What is bisonosis? Bisonosis is a lung disease characterized by prolonged inhalation of toxalite like fiber dust. So, option A is the correct answer. Inhalation of cotton fiber is called as bisonosis. Next, move on to question number 55. The process of comparing services, products, and practices of organization against the strongest competitors in quality control and quality assurance is called as. We'll see the options here. Option A, auditing. Option B, benchmarking. And option C, quality assurance. Option D, quality improvement. Here, option B is the correct answer. Benchmarking. Benchmarking is a process of comparing services, products, and practice of organization against the strongest competitors. Quality control is called as, quality assurance is called as benchmarking. In question only answer is there. The benchmarking definition is here in this question only is there. Next, move on to question number 56. The following is most priority nursing intervention while caring of neonate immediately after delivery. Option A, check blood sugars. Option B, give the initial bath. Option C, give the vitamin K injection. And option D, drying the baby. After delivery of the neonate, the major nursing, first and foremost nursing intervention is drying the baby. Drying the baby is correct answer. Keep the baby warm and stimulating baby to breath. So option D is the correct answer. Next, move on to question number 57. Maternal hypothyroidism during pregnancy can lead to which of the following in a child? We will see the options here. Option A, myxoedema. Option B, cretinism. And option C, acromegaly. Option D, gigantism. Here, maternal hypothyroidism during pregnancy can lead to cretinism. Option B, cretinism. Cretinism refers to the congenital hypothyroidism characterized by failure to grow and skin lesions, and also central nervous system dysfunction also is there. Cretinism here. Option B is the correct answer. Next, move on to question number 58. All the following milestones are present in a 7 months old child except option A, social smile. Option B, sitting with support. Option C, walk without support. Option D, head support. Here, 7 months baby cannot walk without support. So option C is the correct answer. The rolls both ways, front and back, and sits with or without support. The transfer the object one hand to another hand. These are the milestones of 7 months baby. Here, except option C is the correct answer. Means the except is means the 7 months baby cannot walk without the support. Next, move on to question number 59. Which of the following is not a congenital heart disease? We will see the options here. Option A, tetralogy of Fallot. Option B, tricapsid atresia. And option C, Kawasaki disease. And option D, atrial septal defect. Congenital heart diseases, we know the tetralogy of Fallot, tricapsid atresia, and atrial septal defect. These three are the congenital heart diseases, but Kawasaki disease is not a congenital disease. What is Kawasaki disease? Kawasaki disease is a condition that causes inflammation of walls of the blood vessels in the body. Option C is the except condition for the congenital heart diseases. Next, move on to question number 60. Which of the following is sign of rejection of transplanted kidney? We will see the options here. Option A, increased urine output. Option B, shock. Option C, high fever. And option D, weight loss. The contraindication for the transplantation of kidney is option C, high fever. In case of patient is having high fever, we have to contraindicate the transplanted kidney. The fever more than 100 degree Fahrenheit is the contraindicated condition. The warning signs like increased creatinine levels also, and some of the flu symptoms, and pain around the kidney, and fluid retention, means swelling also, contraindication for the kidney transplantation. Move on to question number 61. The site for lumbar puncture in adults is done between which of the following vertebrae? We will see the options here. L1, L2 and L2, L3. Option B, L2 to L3 and L3 to L4. Option C, L3, L4 and L4, L5. Option D, L4 to L5 and L1 to L2. Here option C is the correct answer. L3 to L4 or L4 to L5. It is performed in your lower back in the lumbar region during lumbar puncture. A needle is inserted into the space between the two lumbar bones or vertebrae to remove a sample for the CSF fluid, cerebrospinal fluid. This is fluid that surrounds your brain and spinal cord to protect from the injury. Here option C is the correct answer. L3, L4 and L4 to L5. Next move on to question number 62. The activities aimed at continuous improvement of nursing personnel is called as option A, controlling, option B, staff development, and option C, supervision, and option D, public relations. Here the activities aimed at continuous improvement of nursing professional is staff development. So here option B is the correct answer. Staff development refers to all the policies, practices and procedures used for development of the knowledge, skills and competencies of the staff, improve the effectiveness. So here option B is the correct answer. Let's move on to question number 63. Actions taken to halt the progress of disease at the incipient stage also called as, we will see the options here, primary prevention, secondary prevention and tertiary prevention, rehabilitation. Here the progress of disease incipient stage is called as secondary prevention. The secondary prevention is aimed to reduce the impact of disease or injury that has already occurred. So option B is the correct answer, secondary prevention. Move on to question number 64. Ventilator related complications includes all of the following except options. Option A, pneumoperitoneum, option B, increased intracranial pressure, and option C, mental retardation, and option D, paralytic ileus. Here the except condition for the complication of ventilator related complications is option C is the correct answer, mental retardation. Mental retardation is the except condition for the ventilator complications. Okay friends, the ventilator complications like pulmonary embolism, pulmonary edema, acute respiratory distress syndrome and atelectasis, and also the VAP. These all are the conditions for the ventilator associated complications. On to question number 65. A ventilator that delivers a present constant volume of air and present oxygen is called as options. Option A, high frequency jet ventilator, option B, pressure cycled ventilator, option C, volume cycled ventilator, option D, time cycled ventilator. Here volume cycled ventilator is called as ventilator that delivers present constant volume air present in oxygen. So volume cycled ventilator is the correct answer, option C. Requires the clinician to set the peak flow rate and flow pattern and tidal volume and respiratory rate PEEP. So option C is the correct answer. Move on to question number 66. BIPAP, BiPAP mode of ventilation is an acronym for options. Option A, bilateral positive airway pressure, option B, bilevel positive airway pressure, and option C, bilateral peak airway pressure, and option D, bilevel peak airway pressure. Here BiPAP means bilevel positive airway pressure. This is one of the non-invasive ventilation is the use for breathing support administering through the face mask. Option B is the correct answer. Next move on to question number 67. From this question we got a non-medical questions. Question number 67. If the 7th person from the front in a queue is the 10th person from behind, how many are there is in a queue? Here option B is the correct answer. 16. How? According to given question, person is currently 7th position in a queue. 7th position in a queue from the front. So, 6 person in a front of the person. The person is 10th position in a queue from back. So, there are the 9 numbers in the behind of the person. So, here front is 6, back is 9. So, with person himself 1. So 6 plus 9, 9 plus 1 equal to 16. Option B is the correct answer. Next move on to question number 68. One number which is similar to the number in the given set. 525, 813, 714. We will see the options here. Option A 353. Option B 329. Option C 606 and option D 520. Here option C is the correct answer. Why? Here in this question just clearly observe friends, 525. Actually we have to know what is the number series. Here they given actually 12 number. Between the numbers we have to add the numbers plus 5 plus 2 plus 5 equal to 12. 8 plus 1 plus 3 equal to 12. 7 plus 1 plus 4 equal to 12. Here we have to know which option is similar to in this question. Means we have to plus the numbers. 353 plus equal to 11. 3 plus 2 plus 9 equal to 14. 606 is the correct answer. We got a 12 number. So option C is the correct answer. Number 69. In a family, Mr. Prakash has a wife and he is having 2 married brothers. In that, whom is having 2 children. How many members in this family? Here option B is the correct answer. 8 members. How? In Prakash and wife 2 members. Prakash is having 2 brothers. Married means 4 members. 2 plus 4 is 6. In that brothers, one is having 2 children means 2 members. 6 plus 2 is 8. Option B is the correct answer. On to question number 70. Kavi ranked 9th from the top and 38 from the bottom in a class. How many students are there in a class? Options 45, option B 42, option C 46 and option D 44. Here option C is the correct answer. 46. The 9th place. Kavi is in 9th place. So in front of 8 members is there. From the 38 bottom means 37 from the back. From himself 1 person. So 37 plus 1 is 38. 38 plus 8 is 46. Here option C is the correct answer. We move on to question number 71. Find the missing number in the series. 1, 0, 3, 2, 5, 4. Question means in between 4 and 6 what will number will come. You will see the options here. Option A 9, option B 8, option C 10 and option D 7. Here option C is the correct answer. How? I will explain. Here in the number series, first one they did a minus and second number they add a plus 3. So here 1 minus 1 equal to 0. So here 1 next 0 come. Next 0 plus 3, 3 will come. Next 3 minus 1, 2 will come. Here 2 is there. Next 2 plus 3, we have to add plus 3 and minus. Plus 3 and minus 1. Here 4 plus 3 equal to 7. Option C is the correct answer. On to question number 72. Who is the Prime Minister of Canada? Options. Option A Edouard Philippe. Option B Justin Trudeau. Option C Manuel Valls. And option D Michel Debré. Here option B is the correct answer. Justin Trudeau, 23rd current Prime Minister of Canada since 2015. To question number 73. World Environment Day is observed on option A 5th June, option B 21st June, option C 5th December and option D 1st January. Here 5th June is the correct answer. From the 1972 World Environment Day is celebrating. So here option A is the correct answer. On to question number 74. A is the father of B and C. B is the son of A, but C is not a son of A. How C is related to A? This is the confusion question because here A and B A is the father, B and C both are the son of A. So here one is son and one is daughter. Here option we will see option A nice, option B father, option C daughter, and option D sister. Here option C is the correct answer. If he is not son means she is the daughter. One is male, one is female. That's why here confused question. Don't confuse friends. Option C is the correct answer, daughter. Move on to question number 75. Find out the missing options following. A, C, E, G equal to B, D, F, G and A, K, M, O, Q equal to what? Here we will see the options here. Option A LNRP, option B LNPR and option C LRNP and option D LRSP. Here after A will come B. Opposite side B is there. After C will come D. D is there. Option E. Next E. Next F will come. After G here G will come. So here we have to know after K the alphabet series. After K L will come, after M N will come, after O P will come, Q next R will come. So here option B is the correct answer, L and P R. Next move on to question number 76. Which one is set of letters when sequentially placed at the gaps in a letter series shall it complete it? Okay friends, we will see the option A, B, C, B, C, option B, AC, AC and option C, CB, CB and option D, BB, CC. This question I have to mention, please write down friends, AB dash CA, BB dash AB dash CA, BB. Okay friends, AB dash CA, BB dash AB dash CA, BB and dash. Here option A is the correct answer, BC, BC. Next move on to question number 77. Choose one number which is similar to number in the given set. Options here in this number series 555, 771 and 429. We will see the options here. Option A 444 and option B 656, option C 884 and option D 483. Here in previous question also we got the same similar question. In between what is the relation we have to know. Here 5 plus 5 plus 5 equal to 15, 7 plus 7 plus 1 equal to 15 and also 4 plus 2 plus 9 equal to 15. In this question option D 4 plus 8 plus 3 equal to 15. Option D is the correct answer. On to question number 78. Find the missing number out of the given options. 2 equal to 10, 4 equal to 20 and 8 equal to 40. Then 11 equal to how much? We will see the options here. Option A 45, option B 55 and option C 65 and option D 75. Here we have to know what is the difference of given option. 2 equal to 10 means 1 equal to 5. So we have 12 equal to 60. So 11 equal to, we have to do a minus 5 for the 12. So 11 equal to 55. Okay friends, option B is the correct answer. On to question number 79. Who is the present CEO of Niti Aayog? Option A Rajiv Kumar, option B Aravind Panagyaria, option C Nripendra Mishra and option D Amitabh Kant. Here option D is the correct answer. Amitabh Kant is the second CEO of Niti Aayog. CEO means Chief Executive Officer. In the year 2022, Sri Parameshwaran Iyer is the Niti Aayog CEO. In 2021, option D is the correct answer. Amitabh Kant is the CEO of Niti Aayog. Next move on to question number 80. The world famous Khajuraho capsules are located in. The world famous Khajuraho sculpture is located in Madhya Pradesh. Option A Gujarat, option B Madhya Pradesh, option C Orissa and option D Maharashtra. Option B is the correct answer, Madhya Pradesh. The Chhatarpur district about 175 kilometers southeast of the Jhansi. Here, one of the most popular tourism destination in India is option Madhya Pradesh is the Khajuraho sculptures is located. World famous Khajuraho is located in Madhya Pradesh. Option B is the correct answer. Next, move on to question number 81. Famous rock garden is located in which city? Options: option A Jaipur, option B Shimla, option C Delhi, and option D Chandigarh. The famous rock located in the sector 1 of Chandigarh Rock Garden is a massive open in exhibition hall that displays urban and industrial waste that have been designed by a Nekchand. Chandigarh is the correct answer. Option D. Rock Garden is located in Chandigarh. Move on to question number 82. In which state is Hornbill Festival held in every year? We will see the options here. Option A Nagaland, option B Assam, and option C Sikkim, and option D Mizoram. Is the festival celebrated in Nagaland to encourage the intertribal interaction, preserve, protect, and relieve the richness of Naga heritage. Here, option A is the correct answer. The Nagaland is the state is Hornbill Festival held in every year. Option A is the correct answer. To question number 83. The first woman from India to win a medal at the Olympics. We will see the options here. Option A Karanam Malleshwari, option B Mary Kom, option C PV Sindhu, and option D PT Usha. Karanam Malleshwari is the correct answer. The first woman from the India to win a medal at Olympics. Option A is the correct answer. Karanam Malleshwari, Indian weightlifter from the Andhra Pradesh. The year of 2008 Sydney. Here option A is the correct answer. Next, move on to question number 84. Tansen Samman has been instituted by the government of. Options: option A Uttar Pradesh, option B Gujarat, and option C Madhya Pradesh, and option D Maharashtra. The instituted by government of Madhya Pradesh, option C is the correct answer. Instituted by government of Madhya Pradesh in the year of 1980. Tansen Award is presented every year for excellence in Hindustani classical music. It is presented during the Tansen Samrah at the Gwalior. Here option C is the correct answer. To question number 85. Which Indian state is having the longest coastline? We'll see the options here. Option A Andhra Pradesh, option B Tamil Nadu, option C Gujarat, and option D Maharashtra. Here option C is the correct answer. The first Gujarat has a longest coastline among all the states. The approximate is 1600 kilometers. The second longest coastline in India is Andhra Pradesh. The third longest coastline is in India is Tamil Nadu. But here in this question they have mentioned, they are asking regarding first Indian state having the longest coastline, means option C is the correct answer, Gujarat. Next we will see the question number 86. Which is highest gallantry award in Indian Army? We will see the options here. Option A Ashoka Chakra, option B Shaurya Chakra, option C Mahavir Chakra, and option D Paramveer Chakra. Paramveer Chakra is India's highest military decoration awarded for disciplining act of valor during work time. So option D is the correct answer. Paramveer Chakra is highest gallantry award from Indian Army. Next, move on to question number 87. Which Indian footballer has surpassed Lionel Messi in international goals? Here option A Gurpreet Singh Sandhu, option B Sunil Chhetri, and option C Mohammad Yasir, and option D Amritender Singh. Here option B is the correct answer. Sunil Chhetri is an Indian professional footballer. He is a captain both Indian Super League club Bangalore and also Indian national team. So Here, the Indian footballer has surpassed Lionel Messi in international goals. Option B is the correct answer. Sunil Chetri. On to question number 88. As per BCCI, who is the captain team Indian for ODI T20 series against Sri Lanka in the year of 2021? Options: option A Shikhar Dhawan, option B Hardik Pandya, option C Manish Pandya, and option D Devadut Padikkal. Here, Shikhar Dhawan is the correct answer. In the year of 2021, the T20 series against Sri Lanka, the captain of India from the BCCI is option A Shikhar Dhawan is the correct answer. Next, move on to question number 89. Who has composed India's official Olympic theme song for Tokyo Olympics? We will see the options here. Option A Mohit Chauhan, option B Arjit Singh, and option C A.R. Rahman, and option D Shankar Mahadevan. Here Mohit Chauhan, option A is the correct answer. Indian playback singer. He received 2 times Filmfare Award for Best Male Playback Singer and 3 times G-Sign Awards. Here the option A is the correct answer. Mohit Chauhan, he composed India's official Olympic theme song for Tokyo Olympics. Option A is the correct answer. Next, move on to question number 90. PM Modi inaugurated a Zen garden in which state on the year of 2021 in June 27? You will see the options here. Option A Gujarat, option B Madhya Pradesh, option C UP Uttar Pradesh, and option D Bihar. Here PM Modi inaugurated Zen garden in the year of 2022 June 27 at Ahmedabad. Okay friends, in Ahmedabad, yet Gujarat. Option A is the correct answer. Next, move on to question number 91. India has signed a rail services agreement with which nations? See the options. Option A Bhutan, option B Myanmar, option C Bangladesh, and option D Nepal. Option D is the correct answer, Nepal. The rail services agreement was executed in the year of 2004 between the Ministry of Railways India to Nepal. From India is Rexall, from the Nepal is Birgunji border. So option D is the correct answer, Nepal. Next, move on to question number 92. Who is set to become the second Indian born woman to fly to space after Kalpana Chawla? We will see the options here. Option A Shirisha Bandla, option B Sunita Williams, option C Shavana Pandya, option D none of the above. Here option A is the correct answer. Shirisha Bandla is a India and American aeronautical engineer. She is the Vice President of Government Affairs and Research Operations for the Virgin Galactic. So here option A is the correct answer. She is the second Indian born woman to fly to space after the Kalpana Chawla. Means Kalpana Chawla is the first person. Shirisha Bandla is the second person. Option A is the correct answer. Next, move on to question number 93. Dearness allowance, DA. The DA for central government employees has been hiked to how much from the July 1st, 2021? Options: option A 35%, option B 25%, option C 28%, and option D 20%. Here option C is the correct answer, 28%. In the year of 2021 July 1st, the DA allowance, dearness allowance, central government employee has been hiked 28%. Option C is the correct answer. Next, move on to question number 94. Serum Institute of India will begin manufacturing which among the following vaccines in India from September 2021? We will see the options. Pfizer, option B Moderna, option C J&J, and option D Sputnik V. Here the Serum Institute in India will begin manufacturing in the year of September 2021. Sputnik V vaccine is used to treat a COVID-19. So, the vaccine is used for the COVID-19. Option D is the correct answer. The Sputnik V aims to protect against COVID-19. So, here option D is the correct answer. Next, we will see the question number 95. Which smartphone maker has become the world's second biggest smartphone brand in second quarter of 2021? We will see the options here. Option A, Xmi means Mi. Option B, Huawei. Option C, Oppo. And option D, Vivo. Here option A is the correct answer. The second biggest smartphone brand in the year of 2021 is Mi. Next, move on to question number 96. Who launched the Green Sahara afforestation campaigning in Chirpunji? Okay, friends, who launched the Green Sahara afforestation campaigning in Chirpunji? You will see the options here. Option A, Zakendra Singh. Option B, PM Narendra Modi. Option C, Rajnath Singh. And option D, Amit Shah. Option D is the correct answer, Amit Shah. He is the Union Home Minister, underlining the importance of tree plantation. The main aim of the Sahara afforestation campaigning is underlining the importance of tree plantation. Amit Shah is a Union Home Minister. Okay, friends. Option D is the correct answer. Option D, Amit Shah. Next, move on to question number 97. Various methods of intrapartum fetal monitoring includes all the following except option A, fetal scalp stimulation. Option B, fetal pulse oximetry. Option C, fetal blood sampling. And option D, Braxton Hicks contraction. Here, option D is the correct answer, Braxton Hicks contractions, or also false labor pains, also called as false labor pains. It is occurred in the second or third trimester of the pregnancy. The fetal monitoring, intrapartum fetal monitoring method is including the except condition of Braxton Hicks contraction. Option D is the correct answer. Next, move on to question number 98. Medication appropriate to treat an acute anginal attack. Here I have to mention option A. Some of the typing mistakes, friends. Option A is the nitroglycerin, NTG. Okay, friends. Option B, nadolol. Option C, ethanol. And option D, none of the above. Here option A is the correct answer. Some of the typing errors, friends. NTG. The acute anginal attack, the medication is used for the nitroglycerin, NTG. NTG is a class of medication for the vasodilators used to prevent angina characterized by coronary artery diseases. Here, medication for the chest means acute anginal attack. Angina means chest pain. Acute anginal attack is NTG, nitroglycerin. Option A is the correct answer. See the question number 99. A client is admitted in emergency with hypovolemia. In the nurse should options. Option A, administer pain relief drugs. Option B, administer the antibiotic. Option C, administer IV fluids and contact the physician immediately. And option D, give the prone position. Actually, the hypovolemic means the patient is on hypovolemic. Patient should be placed in the cardiac monitoring. And also, the option C is the correct answer. Administer immediately IV fluids advised by the followed by the doctor or physician orders. Here option C is the correct answer. Potassium replacement to be done after the laboratory confirmation of the diagnosis. So the patient should be under the monitoring of cardiac monitoring. On to question number 100. The major fat in adipose tissue is option A, phospholipids. Option B, cholesterol. And option D, sphingolipids. And option D, tricyclic glycerols. Here option D is the correct answer. Tricyclic glycerol is a adipose tissue, serves as the major energy storage. Triglycerides are the major dietary fat. Here option D is the correct answer. Major fat in a adipose tissue is option D, triglycerols. The last question in this NHM 2022 questions and answers with explanation. Stay tuned, friends. Thank you for watching my video. Please subscribe my channel. Click on the bell icon for further notifications. Thank you.